Okay, what about depression and the surgery? What about depression and the surgery? Well, first of all, before I talk about that, I want to explain that when we analyze depression, we have two flavors of depression. One is pretty obvious, and that's situational depression. Your mom dies. You lose your job. Something terrible happens, you're in an earthquake, or you have Katrina or something like that. These are tragic, terrible, awful situations that would appropriately engender sadness and depression. And you can have a terrible situation that makes you sad, and sometimes medicines can help, like the Effexor. Okay. In theory, if it's situational depression and the situation gets better, you get your job back, Katrina blows away and you get a bailout of $750 billion to rebuild your house. Then you would be happy again because it's situational depression. On the other hand, the other kind of depression, also called clinical depression, or the way I think about it is non-situational depression, you're depressed and you could have the world. You could be, thrifty, brave, clean, neat, hardworking, rich, fabulously wealthy, the president of the world, and everything, and still be sad. Okay? If you're sad in that case and you have all these benefits, then that depression isn't situational because you got a great situation. If you have that kind of depression, then we call that kind of depression non-situational or clinical depression. Okay, with that background, let's come into my operating room and let's take somebody who we operate on. Our average patient's a 39-year-old woman who weighs 300 pounds, who has diabetes and high blood pressure, and maybe sleep apnea and osteoarthritis and whatever. Now, imagine their life with that extra 150-pound backpack they have to carry every day, not sleeping well at night, having to wear the scuba mask to go to sleep, sticking their finger to measure their blood sugar, all those terrible things. That situation, just to think about it, makes me sad and depressed. So if we operate and take away all those events and change the situation, if the patient just has situational depression, we may make them happy. The flip side, though, is if they have underlying non-situational or clinical depression, we could make them better, take away their diabetes, give them $1 million, give them $750 in the bailout, and they still say, I was hoping for more, because they have clinical depression. Now, what we hope is that our patients have situational depression and with the surgery can get better. And so 6 months or a year from now, after you're stable from the surgery, I would meet with your doctor and see, do you want to investigate whether or not you can withdraw the Effexor? Okay. And if it's situational, because you don't have to wear the scuba mask, you don't have the shortness of breath, you're happier with your new cell, if all those things are positive, maybe the depression will go away. Okay. Make sense?
Yep.